our green plan that we've been developing within the organisation. So last year we did some work on the green plan, and one of the things that is important for the NHS, obviously there's the impact on the environment, but the climate change really threatens our health as well. It has direct and immediate consequences for our patients and the public and the NHS. So as well as the overall impact on the environment, we are also concerned about it from a health perspective. So, for example, the situation's getting worse with a lot of the hottest years on record occurring within the last decade, and more people getting killed by heat waves. We've got increased flooding, storms, and the spread of infectious diseases. And all of this obviously has an impact on the NHS, as well as us, needing to create that sustainability and that healthy environment, which is so important for mental health and well-being, and that access to nature. So it's got really important focus, I think, in terms of our overall population health and well-being. So a healthier environment, our objectives really are to create that healthier environment and the healthier community, things like impacts on air pollution, etc. And also make sure we're prepared for changing times when it comes to climate, around protecting our population. So our goal is in line with the NHS net zero target. So the NHS is committed to reaching net zero for emissions that we control directly, and net zero for emissions that we can influence by 2045. And here in Southern, we've done quite a lot of work, working with some consultants to help us understand our emissions portfolio. And I realise this may be small for some of you on the screens, but what we can see is 10% is what we directly control, 10% of our emissions. And that includes things like the gas that heats our buildings and our water, our vehicles, our business travel, heating, air pumps, water, waste. But actually an awful lot of our emissions, 90% of the total, is things that we can influence, but we don't necessarily directly control, but we can influence them. So the bulk of that is our procurement. So the goods and services that we buy from other providers, supplies into the NHS, some of the energy that's indirect, medicines and things that we prescribe to our patients. So all of that needs to come together around our focus. And obviously, more control over the things that we can directly control and make decisions about. But we've also got quite a lot of influence over the large part of our emissions around the way we procure services and goods. So our Green Plan has got 10 areas of focus. There is workforce and system leadership, and the journey today, bringing you all being so engaged around wanting to drive change within the organisation, that is foremost and fundamental, the way we will bring about this change. We need to develop that sustainability community within Southern Health. We need to think about the way we're delivering care. Can we be mindful of the social and the environmental impact in the way we're bringing together care and support? Can we shape our services in a way that has more of an influence over that? Digital will play a large part of this. I mean, we're all meeting today on Zoom. That's saved several journeys in terms of us all coming together within a room. And we've seen that transform the way we've been delivering our care and supporting our team meetings over the last 2 years. And I think there's probably still more we can do around digital to support our more environmental ways of working. And the digital infrastructure itself, let's not forget, also has a footprint. So all of the files that we save electronically, all of the emails that we send, the way we communicate, all of that actually has a carbon footprint. And that's an area that really there's a huge amount more we could do in terms of our use of energy. Travel and transport, again, was massively impacted as we switched to digital, but there could be more we can do, and there could be a way we can switch our emissions around those vehicles that we're using around our travel and transport. Our estates and facilities, we might hear a little bit today about how we've been installing air source heat pumps, as well as thinking about the way we light our buildings, the switches that we use to control lighting to make sure things are switched off in the evenings, and where we're doing refurbishments, thinking about the environmental impact of those. Medicines, as I said, minimising that waste and those direct emissions. The procurement supply chain, really, really important. And actually using less is probably one of the first ways that we can impact on procurement, as well as working with our suppliers around more sustainable ways of delivering. We do have catering, in-house catering, and our use of resources around food and nutrition to our inpatient units is an area that we've been working on, and the Scots team have been doing some work on that. But also, we all eat sandwiches on a daily basis across the staff workload, other healthier ways and more sustainable ways we can do that. Our green space and our biodiversity, we're starting to create back to nature green spaces across the trust, and we could encourage more of that. And then finally, adaptations. So we are finding we're getting hotter, we are finding more floods, global warming, and we do need to think about the impact that that's going to have on our working environment and how we adapt as we move through the next 20, 30 years of trying to maintain and change the impact on the environment, but also making sure we're prepared for what changes that brings. So, as I said, I'm going to hand over in a minute, but that really is the kind of a very quick whittle through the green plan. But what we need now is really to bring people together to help deliver it and enact that change. So any questions before I hand over to Michael to say a few words?